Today we're going to discuss hand washing, the hand washing procedure. This procedure is one of the 5 skills that you will have to perform for your state skills evaluation. So I'm going to go ahead and start with the PowerPoint presentation. Hand washing is the most important thing that you can do to protect yourself and your patients from infection. It is the most important and easiest way to prevent the spread of infection from one patient to another. So today we're going to discuss the when, why, and how of hand washing. The objectives for this lesson, again, are for you to be able to recall the whys, the whens, and the hows of hand washing. You are going to also have time to perform the hand washing procedure. I will demonstrate this after the PowerPoint presentation, and then you will have time to return demonstrate. You will also be able to recall steps of the hand washing procedure. So why is it important? Again, it is important because it reduces the risk of spreading microorganisms from one patient to another, as well as protecting you as the caregiver. It is the easiest and most effective way to keep your patients safe from unnecessary illnesses. To prevent the spread of microbes, you should wash your hands after urinating or having a bowel movement, after changing tampons or sanitary pads, after contact with your own or another person's blood, body fluids, secretions, or excretions, including before and after wearing gloves, after coughing, sneezing, or blowing your nose, and before and after handling, preparing, or eating food. Body secretions include saliva, vomit, urine, feces, vaginal discharge, mucus, semen, wound drainage, pus, and respiratory secretions. All of these are necessary to understand that they may possess infectious materials. So you need to know what kind of bodily fluids are conducive for you to need to wash your hands. So again, hand hygiene is the easiest and most important way to prevent the spread of infection. You should practice hand hygiene before and after giving any and all care. The hand washing procedure. Your uniform during the procedure should not touch the sink. The sink is considered to be contaminated. By allowing your uniform or your body to come in contact with the sink, you could potentially cause those microorganisms on the sink to get on you. So make sure that you are standing away from the sink. You must have soap and water within your reach. Your hands are kept lower than your elbows during the procedure. This is to prevent those microorganisms from coming up your forearm and causing your forearms to become contaminated, or even your watch. Most of you, or if not all of you, should have a watch on as a nursing assistant. If you are using a paper towel dispenser with a lever, you should roll off a generous amount of paper towels before beginning this procedure. This is so you don't have to touch another piece of equipment after your hands are now clean. This way, all you have to do is tear off those paper towels, use them, keep one dry so that you can dispense more paper towels without actually coming into contact with a piece of equipment. You will remove your watch and bracelet, or at least push them up 4 to 5 inches above your wrist. This is again to prevent the spread of infection from your hands to jewelry that you have to wear as a caregiver. The only thing that you can keep on is a smooth wedding band. And you can use a smooth wedding band only because it doesn't have those little crevices that may potentially hold in those microorganisms. You will turn on the faucet and adjust it to a warm, comfortable temperature. Don't get it too hot, don't get it too cold. Make sure that it is a comfortable temperature so you're not scalding your hands and you're not freezing your fingertips. Wet your hands thoroughly, including 3 to 4 inches above your wrists. Apply a generous amount of soap If you're using bar soap, you should rinse off the bar soap before lathering your hands, and then again rinse that bar off before putting it back onto the soap dish. Rub your palms together for at least 15 seconds to work up a good lather. Then you will do the following steps for at least 20 seconds. This is when you are actually washing your hands. You're going to wash using friction and rotating motions. You're going to wash the palms and backs of your hands, your fingers and in between your fingers, your wrists and lower arms, and you're also going to use what we call an orange stick or a manicure stick to clean well under your fingernails. You can scratch the palms of your hands with your fingernails to clean out from under them, but the orange stick and the manicure stick actually get underneath those nails to make sure that they are clean. Then you're going to rinse well from your arms to your hands. Make sure that the water is running from your wrist to your fingertips. This again is going to prevent anything that was on your hands coming up your arm. With a clean, dry paper towel that you have dispensed, you're going to dry your hands from your fingertips up to your wrist. Once you get to your wrist, you need to discard the paper towel. You're going to keep part of that paper towel dry so that when you need to dispense more paper towels, if it's a lever type paper towel dispenser, you're not using a wet paper towel to dispense it. By using wet paper towels on pieces of equipment, the microorganisms can actually come back through the paper towels back onto your hands, which is something that we don't want to do. So you're going to use the dry paper towel to dispense out more to be able to use for your other hand. You will discard those paper towels once you are done drying both of your hands. Then you're going to take a now clean, dry paper towel to turn off the water faucet. Again, same principle applies. You don't want to use wet paper towels because microorganisms can come through the wet paper towels back onto your now clean hands. So now we're going to go over to the lab area. I'm going to demonstrate to you how to properly wash your hands, and then I'm going to give you time to return demonstrate to me, and I will open the floor up for any questions after the procedure, and I will correct anything that you may have misinterpreted. Okay, come on over to the lab area.